So I had this patient, right? I'm sensing a trend here. And she had this back pain, and it was like in that 8, 9, 10 area. That, like 7, 8, 9, 10. Definitely 9 and 10 for sure. I'm going to say 8, 9, 10, 11, maybe. And it was coming out in between the ribs on that right side. And if it's coming out between the ribs, it's some kind of like an intercostal thing, some kind of a funny thing. Anyways, there's like, lightning bolts coming off it. Great. So it really, really hurt. We want to fix that, of course. Now, one important thing about this back pain is that the patient was pregnant, which is great. Hooray! In any case, with pregnancy, there's some pretty extreme changes in the body for obvious reasons, but there's some pretty extreme changes that can bring a problem like this out because of the way that it actually pulls on the body. So this particular problem here was not just stuck, it was stuck in flexion, so it was around like that. On this side, you'd say it's around like that, a flexion, a forward fold. But it wasn't just a flexion, we also had a rotation to the right, like that, and we even had a side bend to the right within that small region. Some people would call this a thing. There's like a name for this stuff, but it was definitely all torqued up, and it was stuck there, and it was rigid, meaning it had been there for quite some time. This was not a new problem, and it probably preceded the pregnancy. So that's a big deal. Anyways, with the pregnancy, the reason why it's an issue, not the pregnancy itself, but the way the mechanics change, is because we start picking up weight in front. There's a baby in here, and there's also amniotic fluid, which I don't think gets mentioned a lot, and it weighs a lot. So it starts to pull through that body. It starts to pull or push, depending on how you look at it. The rectus abdominis, transverse abdominis. It starts to then pull through the shared fascia into the obliques, like so. And then it will pull through even the QL shared fascia, all the way into the lumbodorsal sacral fascia, whatever you want to call that. Anyways, it starts to pull into the lumbar spine, of course, and the lumbar spine's totally okay with that because it has facet orientation, and facet orientation will definitely give it some ability to go into extension. It will be pulled forward here and totally fine. Now, the problem with that is not so much the lumbar spine. The problem is this extension is ascending. It's going up into the spine, and when it hits that flexion curve right here at that 9, 10, 11-ish area, it will resist it. It's flexed. It doesn't want to extend, so it will resist. With this kind of a problem, the vertebra is twisted that way. We can put that right into rotation. Oh, look. Magic of layers. Anyways, it is rotated like so. So we've got the right side back, and we've got comparatively the left side forward. Cool, right? No problem. Actually, yeah, kind of a problem. That's why we mention it. Anyways, with the right side back, it doesn't want to move forward into extension, but with the left side already forward, it will move much further into extension. That muscle's going to grab, and that muscle's going to pull, and it'll pull it farther towards the left side being forward. You call that a right rotation, but the left side is going further forward. However you want to word that, that's fine by me. But the thing is, when we start doing that, when this side starts going relatively forward, it's as if this side was going relatively further back. And as it pushes back, it starts to spread out those ligaments in the air. Those ligaments start to spread apart, and those muscles and those fascias start to spread out even more than they already are. And with spreading of tissues, with it coming apart, we get more and more pain building. And this is, of course, a problem because you don't want to be in horrible stabbing pain in between your ribs while you're trying to carry a baby around. That's a big problem. So, how do we fix this? Because that's always the question. One way we could deal with this is wait for the baby to be born, but that's probably a bad idea. Because this is a number of different patients, it's of course never one, but because this is of a number of different patients, it's happening early into the pregnancy, so that's a bad idea. There'd still be many months with all this pain, and then, when the baby actually comes along, they're like on the ground, like they can't walk, you gotta pick them, you gotta lift them, they're really heavy. Anyways, you don't want to do that. So, instead, what you probably could do is you could untwist all this area, get it to straighten right out for you, and guess what? That extension that was being resisted in that spot would come nicely through there, and we get a nice balance of curvatures, and that strain and that pain would go away. You know how to do that, right?